Hi all, welcome to our Allied Lecdem channel. In this video, we are gonna see about bones of lower limb. So, in this, particularly, we are going to concentrate about femur bone. So, let's get into the video. Femur bone or thigh bone is the longest and strongest of the body. Femur has two ends, namely upper and lower, and a shaft. The head of the femur articulates with the acetabulum in the pelvic bone, forming the hip joint, while the distal part of the femur articulates with the tibia and patella, forming the knee joint. By most measures, the two femurs are the strongest bone of the body and in humans, and these are the largest and thickest. So, femurs are the longest and strongest of the body. Next is the side determination of the femur bone. The upper end bears a rounded head whereas the lower end is widely expanded to form two large condyles. The head is directed medially whereas the cylindrical shaft is convex forward. Next is the parts of the femur bone. The first thing we'll concentrate is the proximal part. It consists of head and neck and two bony processes like greater trochanters and lesser trochanters. There are also two bony ridges connecting the two trochanters. They are intertrochanteric line anteriorly and trochanteric crest posteriorly. So, the first is head. The head articulates with the acetabulum of the pelvis as we saw in first, so it helps in forming the hip joint. It has a smooth surface covered with articular cartilage. The next is the neck, which connects the head of the femur with the shaft, that is the body part. It is cylindrical, projecting in a superior and medial direction. This angle of projection allows for increased range of movement at the hip joint. The angle of approximately is 135 degree. Next is the two bony processes. The first one is the greater trochanter, the most lateral palpable projection of the bone that originates from the anterior aspect just lateral to the neck. Next is the lesser trochanter. Smaller than the greater trochanter, it projects from the posterior medial side of the femur, just inferior to the neck shaft junction. Next are the two bony ridges connecting the two trochanters. They are intertrochanteric line and intertrochanteric crest. Intertrochanteric line are the ridges of bone that runs into a inferior-medial direction on the anterior surface of the femur, spanning between the two trochanters. It is also known as pectineal line. The next is the intertrochanteric crest. Like the intertrochanteric line, this is a ridge of bone that connects the two trochanters and is located on the posterior surface of the femur. So, as we could see in this image, the head, which articulates with the acetabulum to form the pelvic joint, whereas the neck, which anchors between the head and the shaft of the femur bone. Next are the two bony processes. They are greater trochanter and lesser trochanter, and two ridges like intertrochanteric line and intertrochanteric crest. The next is the shaft at the body of the femur, which descends in a slight medial direction. This brings the knee close to the body's center of gravity, increasing the stability. So, on the posterior surface of the femoral shaft, there are roughened ridges of the bone called linea aspera. This splits distally to form medial and lateral aspect of the supracondylar lines. Next is the proximally the medial border of the linea aspera becomes the pectineal line. The lateral border becomes the gluteal tuberosity where the gluteus maximus attaches. That is the muscle named gluteus maximus attached to it. Next, in distal way, the linea aspera widens and forms the floor of popliteal fossa. The medial and lateral borders form the medial and lateral supracondylar lines, and this ends at adductor tubercle where the adductor magnus attaches. So, in this image, we could see about pectineal line, gluteal tuberosity where the gluteus maximus attaches, and medial condylar line, lateral supracondylar line, adductor tubercle where the adductor magnus attaches. Next is the distal. Distal part is characterized by the pressure of medial and lateral condyla, which articulates with tibia and patella to form the knee joint. The medial and lateral condyles are rounded area at the end of the femur. The posterior inferior surface articulates with the tibia and menisci of the knee, where we saw, which articulates with the patella forming the knee joint. Next is the medial and lateral epicondyle. The bony elevations on the non-articular areas of the condyle and the medial epicondyle is larger. Intercondylar fossa is a deep notch of the posterior surface of the femur bone between the two condyles, that is medial and lateral. It contains two facets for attachment of ligaments, namely capsular knee ligaments. The anterior cruciate ligament attaches to the medial aspect of the lateral condyle, whereas the posterior cruciate ligament to the lateral aspect of the medial condyle. So, in this image, we could see the lateral condyle, medial condyle, where the muscles of anterior cruciate ligament and posterior cruciate ligament attaches. Also, the adductor tubercle, medial epicondyle and lateral epicondyle in both anterior and posterior surface. Next, the foremost important function of the femur bone is the weight bearing and stability of gait. As we saw, it is the strongest and longest bone of the body. So, it is the main function is to the weight bearance of the body and providing the stability of the gait. Next, an essential component of the lower kinetic chain, which helps in maintaining the stability of the part. Next, are the part of the femur where the borders and surfaces. Middle one-third of the shaft, the borders like medial, lateral, posterior, whereas the surface related to it are anterior, medial, and lateral surface. The upper one-third of the shaft, the borders, it consists of medial, lateral, spiral, and gluteal tuberosity. The surface it belongs are anterior, medial, lateral, and posterior. The lower one-third of the shaft consisting medial, and lateral supracondylar line. The surfaces including anterior, medial, lateral, and popliteal surface. So, we know in the lower time, that is in the thigh region, there is only one bone running through. There are lots and lots of muscles being attached with it, namely iliacus muscle, psoas major muscles, gluteus maximus, medius and minimus, and obturator internus and quadratus femoris muscle, obturator externus muscle, adductor brevis, adductor magnus, vastus lateralis and intermedius and medialis. Also, articularis genus muscle and gastrocnemius muscle. So, next are the clinical anatomy. What are the conditions which is being related to the femur bone? The first and foremost important are the fractures, which are greatly and depending on the force that causes the break. The piece of bone may lie and correctly or be out of the alignment, that is stable or displaced fracture. The skin around the fracture may be intact. So, based on this, the fractures have been again classified into closed or open fracture. That is, when the bone may puncture and pull out of the skin, which is termed as open fracture. So, this femur fracture is again subdivided into transverse, oblique, spiral, comminuted, and open fracture. So, as we could see in this image, the first is the oblique fracture, where the angle is lying across the shaft, whereas in comminuted fracture, the bone has broken into 3 or more pieces. In most cases, the number of fragments correspond with the amount of force needed to break the bone. That is, the bones are being crushed or it's been fragmented by the force, the external force it causing the breaking of the bone. So, let's quickly recall the anatomy of the femur bone. Proximal part consisting of femoral head where pointing in medial, superior and slightly anterior direction. The ligamentum teres femoris connects the acetabulum to fovea capitis. Neck attaches the spherical head at the apex and cylindrical shaft at the base. The two prominent bony protrusions, they are greater and lesser trochanters that attach muscle that move hip and knee. The shaft has mild anterior arch, which is convex anteriorly with maximum convexity in middle where shaft is narrow. Next is the distal femur. As you know, it is characterized by medial and lateral condyle which articulates with tibia forming the knee joint. So, the shaft flares out in the cone-shaped manner onto a cuboidal base made up of medial and lateral condyle. So, this medial and lateral condyle join the femur to tibia forming the knee joint. And we know the function is the stability and weight bearing part. The muscles attached to this are gluteus maximus, medius, psoas major muscles, and articularis genus muscle, gastrocnemius muscle, adductor, longus, brevis, magnus, and so on. Next is the clinical anatomy is the femur fracture, which is the most commonly occurred fracture, typely transverse, oblique, spiral, comminuted, and open fracture. So I hope you got a brief idea about femur bone. So let's see in another video. Thank you.